Perfect. All right. Again, hello, everybody. Happy Friday. In fact, happy Black Friday. I'm really excited to be giving this talk today, as I had just mentioned over Facebook that this is a test that has actually been really beneficial for me. And I am really excited to have this as a new addition to my practice as well. So today, what I am going to be doing is I'm going to give you a little bit of background on what exactly organic acids testing is. I'm going to give you the benefits of what sort of health conditions it can help with. Obviously, earlier in the week, you saw a little post about what alternative testing can help with, particularly with blood sugar dysregulation, mood changes, insomnia, joint pain, any sort of symptoms of autoimmunity and inflammation in your body. This test is crucial. And it actually goes a little bit deeper than what a normal blood test would do. So that's why I'm really excited to be presenting it to you today. Now, with that in mind, speaking of presenting, I should probably present myself too. Hi, my name is Drew Mulvey. I am a certified dietitian nutritionist. I have a master's degree, obviously, in nutrition from the University of Bridgeport, which is more functional medicine based. I am a board certified nutrition specialist, and I am also a certified LEAP therapist, which is a specific food sensitivity protocol that is very hyper specific for hypersensitivity. It's about 92% accurate and specific. It is based on an MRT test, which screens for these hypersensitivities. And then there is a food protocol that I walk you through once you get the results. It's been amazing. I am on my 13th week. I already feel like I'm getting energy from food again. I feel like there's a much more brain clarity. And I shared this a couple of weeks ago that I'm really not needing caffeine in the morning anymore for some sort of symptoms of ADHD that I had been diagnosed with previously. So very exciting. Now there is this test. I'm going to share my journey. I don't know how many of you know this, but I have battled several health issues in my past. When I was 20 years old, I was diagnosed with chronic fatigue, immune dysfunction, and fibromyalgia. I had a candida build up, so that can contribute to a bunch of different symptoms, such as mental fatigue. For me, it was attacking my immune system, and I wasn't really able to fight off anything. Actually, speaking of which, I was diagnosed with an autoimmune condition where my natural killer cells were attacking themselves, and I wasn't able to fight off any sort of pathogens, any sort of disease. So I was getting sick all the time. And then from there, I found alternative medicine, and that really helped me for a time. But then there were other things that started coming. I've had endometriomas in the past. I experienced hyperthalamic menorrhea, which you lose your period for an amount of time. I actually lost my period for 5 years, which made me, how do I say this, borderline osteopenic. So it's not osteoporosis, but your bones are starting to get a little bit more frail. So from all of that and all of my health battles and starting to find alternative medicine, I also in my master's program learned about these tests, and we went into very, very deep detail on these tests. So I had actually had one of these run on me. I would get myself checked actually pretty much every year for 3 years, and it helped me immensely. When I learned about these tests, I was all in, and I now am able to give out these tests for those that, if they're experiencing joint pain, if you're experiencing any sort of fibromyalgia, autoimmunity, inflammation, that's basically what it is inflammation in the body, blood sugar dysregulation, mood changes, bloating, gas, constipation, any sort of gut issues, acid reflux, I had put that on there. This test is going to be super, super beneficial for you. So what exactly is so much more beneficial about this test as compared to a CBC or a metabolic panel? Well, these tests actually screen for yeast and fungal markers as well as bacterial markers, which you're not really going to see much of that on a blood test. Yes, there is eosinophils, which are typically elevated. They're a white blood cell that can be typically elevated when somebody has parasites. But other than that, you're really not going to be able to see in depth what's going on in the body. These particular tests Obviously, you're not going to see if there's candida either. Now, somebody could be having mental fog. Somebody could have a lot of fatigue. Somebody could be getting sick all the time, like I was. It could potentially be candida. But here's the thing. A lot of people have been suspecting that they have candida buildup, and really, you don't know. So testing is super important. Get tested before you start treating yourself, because then you might be treating the wrong thing. It's always important to see what it is. And then there's also bacterial markers as well. Bacterial markers are going to say, in particular, this one that I'm running, it looks into Clostridium species. So if you're having diarrhea, mucus in your stools, Clostridia is usually responsible for those. And yes, I have had that happen before, and I've had Clostridium. It's not great. Now, interestingly enough, there's different Clostridium species. One of them in particular is responsible for the production of serotonin. So that's our feel-good neurotransmitter. So you need a certain amount of those Clostridium species, but if they start to proliferate, then over time, what happens is they proliferate so much and they can actually emit gases in your stomach, and it can be really dangerous. So it's really important to screen those before it becomes a problem. As such as with me, I did not have this test at that time, and I could have started to do things to get rid of it, needless to say. There's also other screening for other yeast and fungal species as well, in particular Aspergillus. So if you're experiencing any sort of respiratory issues, sinus infections, chronic sinus infections, Aspergillus can be one of the issues with that. Asthma, any sort of breathing issues, definitely look into this test, because then that'll give you a surefire way. Is that really so much a fungus that's causing this, or is it something else? But also this test screens for energy pathways. It screens for fat digestion and metabolism in your body. And it also screens for neurotransmitters. Now, I'm actually going to show you a sample test right here. So here's the sample test. This is from Great Plains. That is the company that I'm going to be ordering these tests from. As I said, there's yeast and fungal markers here, and then there is also bacterial markers. So that's really important that you start looking at these, because it can give you an indicator if you do actually have a candida buildup. Again, test before you know. And as I was saying, there's markers of energy metabolism. There's markers of fat metabolism. There's also neurotransmitter markers, which is really important, especially when you're super stressed. That one you're going to see down here are neurotransmitter metabolites. Now, when one is super stressed, what can happen is that tyrosine can actually be depleted in your body. Now, tyrosine is very important for your thyroid hormone. Super important, and for thyroid metabolism. So if you don't have enough tyrosine in your diet, or tyrosine is not being converted, tyrosine is at the beginning of the cycle before dopamine is produced. So if there's any issue with that, if there's any issue with these neurotransmitters, that can be a surefire indicator that somebody is very stressed out, and also producing a little bit more inflammation. Particularly this one down here, you're going to see, you can't really see very well. It's called quinolinic acid. That one is going to be a marker of inflammation. So in particular, what happens, this is with tryptophan metabolism. Tryptophan normally is responsible for the production of serotonin. It is also responsible for the production of B3, niacin, which is important for energy pathways. Now, down that line, you're going to see other metabolites in there as well. So there's another one which could be responsible also for pain perception, which is kynurenate, and there's xanthorinate too. You could be low in vitamin B6. That's very common actually. When I had fibromyalgia, that was one of the common symptoms in me. Is it was so hard for me to get up in the morning. I would actually be crying sometimes because my energy pathways were not functioning properly, and I had a B6 deficiency. So it kind of made sense. But then the problem is once you have that deficiency of that cofactor, obviously some metabolite is going to be elevated, but it can also go downstream, that instead of producing energy and producing serotonin, tryptophan can actually be converted into inflammatory proteins. So that's the quinolinic acid right here. And that can be obviously elevated in autoimmune diseases, any sort of inflammatory diseases, IBD, you name it, it could be elevated. So we like to look at those. Obviously, if you're really stressed out, if they've been experiencing a lot of anxiety, or especially if you're an endurance athlete, you're going to be producing a lot more oxidative stress. So it's very important to screen how much inflammation is going to be going on in your body. Now, that also brings me back. There's also detoxification markers that this test looks at as well. Now, detoxification is super important. I have talked about this before with my 21-day whole food detox, that detoxification comes technically in 3 phases, but really 2 happen in the liver. The 3rd phase is through the intestines and through the kidneys. But the liver is responsible. The lymph actually starts to bring toxins down into the liver, and those are fat-soluble toxins. They go through phase 1 liver detoxification, and then they are turned into water-soluble toxins. Now, the thing is, phase 2 liver detoxification has to grab them quickly because they can be more toxic than the fat-soluble toxins that actually came in. So goes through phase 2, becomes more water-soluble, and those toxins are either released through the bile into the intestines and out through the feces or through the kidneys. So again, you want to be hydrating properly. But another problem is that it could be inflammation in the body. And if you're not detoxifying things properly, there is a particular pathway known as the glutathione pathway, which is a conjugation pathway. You're not going to necessarily be detoxing properly if your glutathione stores are being used up, and especially if you are very inflamed. Glutathione is your body's natural antioxidant. Now, if that is depleted in any sort of way, then there's going to be a lot more oxidative stress. You're not going to be detoxifying properly. And when toxins, especially, here's one thing: if you start to get constipated, then those toxins start to recirculate through your body and create a lot more inflammation. So it's really important to be regular, obviously. And it's really important to have fiber in your diet, but it is super important that you do have enough glutathione in your body to be able to combat that oxidative stress. So that's a great thing that this test actually screens for. And also with fat metabolism. So there's metabolites, or particularly of fatty acids. In particular, we need carnitine to be able to turn fat into energy. It's basically fat into energy. Now, if we're not digesting fat properly, then this test is going to be able to pick up on it. If we're not converting properly, especially with fatty acid oxidation to get that energy, this is going to pick up on it. Now, unless you are on a low carb diet, this could indicate, well, if you're on a ketogenic diet, then those markers are going to be a little bit elevated. But if you're not, then that's an indicator to me that you need better energy and that you need probably something else to help you out as well. Going into other things, I think I just talked about the detoxification. There are also vitamin metabolites. It looks at vitamin C, vitamin B12, folate, and vitamin B6 and CoQ10. Now, those are super important. Vitamin C is going to be critical as an anti-inflammatory, antioxidant, but it's also very important for joint health because it actually helps with the creation of collagen. Now, if you're deficient in any sort of way in vitamin C, then your body is probably a little bit more, I don't want to say inflamed, but you could need a little bit more antioxidants in your system. Now, particularly B12, folate, and B6. Now, those are very important for methylation. Methylation is part of liver detoxification, so that obviously gets things out of your body, but it is very important for brain health, and it's very important for your genes as well, as it helps to protect the DNA. And it also helps to keep the homocysteine down. So homocysteine is usually elevated in those with brain issues, as it can be a neurotoxin, so to speak. And you need to have homocysteine clearance to be able to get everything out. Now, without that proper methylation, you're not going to be able to get those things cleared out. So if you have an issue, B12 is usually associated with energy pathways, folate as well, B6 because it helps with that energy production as well. B2, B3, B1, especially if you know anybody that has had issues with maybe alcohol in the past, any sort of issues with the liver, B1, B2, B3 could potentially be depleted. And those are very important in energy pathways, particularly the production of acetyl coenzyme A, which helps with obviously energy production because that's needed for ATP to be produced as well. Now, if there's any sort of issue with B1, B2, B3, then you're not going to be producing energy properly. And that's what this is going to screen for. It's going to tell us if you are, what happens when you don't have very good energy? Well, it's not just about how you're feeling. Yes, you're going to be feeling fatigued, but you're going to have a lot of mental fatigue. Your cardiorespiratory system, it's very important for energy to be fed, especially that ATP to be fed into that system, or else you're going to have a little bit more oxidative damage, or I shouldn't say oxidative damage, but a little bit more oxidation around there. It's important for brain health, obviously, as I was just saying. So again, what I like about this, okay, so probably you think, why don't I just get a CBC from the doctor? Now, I do look at those definitely have their place, but with these vitamins on here, it actually looks at a depletion before it becomes a deficiency, before it becomes a pathology, which is super important, especially when it comes to B12 and folate. Now, interestingly enough, a lot of people have issues with metabolizing folic acid, which is the synthetic version of folate. It's very common. There's actually a genetic mutation in a specific gene that's responsible for the conversion of folate. If you have this mutation, if you're homozygous for it, you are not able to metabolize folic acid, and that can actually increase an inflammatory protein in your body. So it's really important that this can actually screen for that. Very interesting. I think that I've pretty much covered everything on here that I really, really like. Obviously, we're going to be seeing how your energy pathways are. So the Krebs cycle is responsible for energy production in your body. And there's different cofactors, or as they say, different vitamins that feed into that. Now, if any of those metabolites are going to be elevated, then obviously that's going to give us an indicator of what vitamins you're deficient in that's not feeding into that particular Krebs cycle and to get the energy produced. So again, you're not going to be able to get that on a CBC or a complete metabolic panel. Now, the CBC and the complete metabolic panel, yes, they're great because you can see how your blood sugar levels are. You can see your vitamin D levels, which is really important because you need proper vitamin D levels to be able to fight off any sort of pathogens, viruses, bacteria. It's also important for your brain health too. It's important for sex hormone production and hormone production. Vitamin D, it has so many functions in the body, and it's an antioxidant as well. So very, very important that you have optimal vitamin D levels. Obviously, you can get your iron checked as well. But this test actually screens for that too. I was talking about energy pathways and in the Krebs cycle, that if there's an enzyme that's not functioning properly, it could be an indicator there that there could be a magnesium deficiency, an iron deficiency, and even a B2 deficiency or B vitamin deficiency. Very, very interesting. That's why I love this test so much. So as you're starting to see, all of these different factors are starting to feed into how the body is working as a whole. And that's what I try to do in my practice. If you're looking for weight loss, if you're looking for better stamina, if you're looking to balance your hormones, if you're looking to have better gut health, this test is going to be a great indicator of what's going on overall. So we can not just attack one of those things, we can get to the root cause of everything and then take a therapeutic approach to this, which is what I try to do. I try to take a holistic approach and an integrative approach to all of this. What I would do is integrate, obviously, I make food recommendations and nutrient recommendations to people. I also have a dispensary for my clients, which you get 10% off if you sign up with me, which is very exciting. This dispensary is some of the best nutraceuticals in the country. They are some of the best nutraceutical companies, in the country, which means that they have been third-party tested, that whatever is in them is in them. So whatever's on the ingredient label, it's actually in there. So it's very important. That's where the third party testing comes in. So it tests for that, that purity as well. So very important. But other than that, organic acids testing, obviously it's going to be beneficial for those that have joint pain. If you have blood sugar dysregulation. That could be an indicator of some sort of stressor in your body as well. Because I've talked about that several times, how stress can tend to make you a little bit less insulin sensitive because of the inflammation that's in your body. And then cortisol can also go up. That's also, I do have to point that out, that if you are under loads of stress, this is going to be an indicator as if cortisol levels are an issue, because sometimes it can be adrenal fatigue, but then there's adrenal burnout. And adrenal burnout is where your adrenals can't even produce cortisol anymore. Now, cortisol can be good in the short term because it's actually an antioxidant. So if you're not even producing that a little bit, then you could have a little bit more of oxidative damage. So again, before you attack something, it's important that you test. With that in mind, if you are suffering from any sort of these ailments, or if you're just curious about what's going on in your body, if you want to have better stamina, if you want to have less joint pain, if you want to have better brain function, better gut function, less rashes, less acid reflux, or just general health overall, I highly recommend this test. And I am going to be having a deal for the next month until December 17th. This test is usually $249. This month, it is going to be $169 for anybody. Well, I shouldn't say anybody who signs up with me, but here's going to be the kicker. You can get this test. This is going to be the deal. You can order this test through me. Normally, I would just have these for my clients. You can order these tests with me, and you get a follow-up to go over your tests. It's only $30 with me. $30. That is a steal. Normally, a half an hour appointment with me is between $50 and $75. So I'm really decreasing the price on that. We can really look over what's going on in your body. We can look over your brain function. This is an excellent, excellent deal. You do not want to miss it. As I was saying earlier, I have had organic tests done on me, and it has been so beneficial for my health because, as I said, it looks at vitamin depletions before it becomes a deficiency. It looks at if your body is using up too much of its antioxidants. So if there's inflammation, if there's amino acids such as tyrosine, so amino acids are part of a protein, there's usually 20 amino acids. And it's also the precursor to dopamine, which helps with our focus and our mood. So obviously, if that is off in any sort of way, then this is going to be a good indicator of, is that what's causing all of these issues? And obviously energy pathways, detoxification pathways, which can also contribute to joint pain. And then yeast and fungal markers, which could be an indicator of if you're having respiratory issues, asthma, any sort of things like that, chronic sinus infections, that can give us an indicator if there's any fungal issues going on, or even mold. And bacterial as well, especially if there's any sort of diarrhea or any gut dysfunction that you may possibly be experiencing. So with that, if this sounds like you, I would highly recommend DM me with your information. Let's get your information in the system and let's send you out for testing. This usually takes about 1 to 2 weeks to get the results back. And then from there, we can set up an appointment and we can go over your results. I'm in love with this test. I think that this would be super beneficial to you. And maybe you're saying, oh, well, I know it's the holidays, but I really do want to start feeling better. Well, maybe this might be your answer. Then let's do it. If you are interested in possibly signing up, I usually work with overachieving active females. So endurance athletes can definitely be one of those. I help them to balance their hormones. I help with better GI function. I help to repair their relationship with food, because a lot of things can be in the mind, and to have that good, healthy relationship with food is not only beneficial for your mind, but very, very beneficial for your body, especially making sure that you're getting enough nutrients in your body as well. I also help women with better stamina, and I also help them to lose weight. As I was saying before, I look at the root cause of what is the issue instead of just targeting one thing. And from there, I create sustainable lifestyle habits. So if that sounds like something that you want to do, and you're tired of beating around the bush, you're tired of trying all these weight loss programs, you're tired of trying to figure it out yourself, Dr. Google or other things, then let's talk. Send me a DM, give me your information, and let's set something up. And for those of you who have joined today, I just thank you so much. I really hope that this has been beneficial to you and very educational. I really hope to be speaking to all of you soon as well. So with that in mind, happy Black Friday. You definitely don't want to miss this deal. Again, it's going to be $169 for this test and then a $30 follow-up with me. It's normally between $50 and $75 with me for a half an hour. So this is a really, really good deal. And then this test is normally about $249. So again, you gotta hop right on it. All right, everybody. I hope that you have a wonderful Black Friday and I will see you soon. Take care.